it was only in my final year I started watching Grey's Anatomy, and I would kind of convince myself it was revision, but it wasn't. But it is actually quite, I mean, apart from the drama, like some of the cases that come in, as ridiculous as they sound, I'm sometimes like, that could so easily happen in the hospital. Like, I'm not surprised.
Welcome back to the Mousify podcast, guys. Finally, the episode that we've been waiting for since we've started. We finally have a doctor. So my parents are both doctors. My brother's also a doctor here. So I've grown up around doctors most of my life. And so that's kind of the reason why, ever since we started this, especially for me, this episode is like super close to the heart. So today we have a very, very special and unique guest, and someone who we think will give a lot of value to a lot of people in the UK, especially right now, with a lot of news and headlines around the NHS and what it means to be a doctor. So for this episode, we have Dr Theresita, a junior doctor in her second year of medical training working in London, currently based on acute medicine at Charing Cross Hospital. She went to UCL for uni, where she met Alex, and she did an integrated BSc in Neuroscience and took a further year out to do a master's in Dundee, Scotland, on Parkinson's disease research. She has a very special interest in Parkinson's, and maybe we can get into that later on in the podcast. And that's her main driving reason for doing medicine and research. So without further ado, welcome in Dr. Theresita to the Mousify podcast.
Oh.
Welcome.
Thank you so much. That's such a lovely introduction. I've not done a podcast before, so hopefully I give some like useful insights today. I'm Theresita. Everyone calls me Terry. As you said, I'm working in West London at the moment on quite an acute medical ward job. So seeing like lots of different patients with like a really ranged variety of things that come in. And I'm really enjoying that. It's very different. And then in 4 months' time, I'll move on to renal medicine. So dealing with a lot of patients with quite acute kidney injuries. And it's quite a specialist centre where I'm working, so it'll be quite intense, I also imagine. But ask away whatever questions you want.
So Manu has been really looking forward to having this episode. Me, on the other hand, I have been too, but I know nothing about medicine. So a lot of what you've just said has gone completely over the top of my head. Should we start off high level? What is medicine? How do you become a doctor? What's the difference between being a GP, different specializations, like being a consultant? What does it all mean?
Okay. So in terms of the first question, in like, what is medicine? I feel like that is a question also that people ask in med school interviews, where they're always like, why do you want to do medicine? People get really like flustered over what to say. For me, what I'd say, like what medicine is, it's the ability to basically detect, diagnose, and then try to treat a range of medical issues that people present with. I would say that's what it is at its core. It involves a lot more than that, but it's like coupling, being able to diagnose, and then also the human aspect of working with human beings who have like emotions and kind of fears around that and trying to navigate that. So that's what I'd say the definition of what I think medicine is. In terms of like the difference of like hospital medicine versus GP, I feel like most people will encounter a GP, which is a general practitioner. So it's like a community-based doctor where they're very accessible. People of all ages, genders will go and kind of present their concerns of what they think they're worried about. So that might be like a mum really worried about her baby having like a really bad cough, to like a granddaughter who brings in her grandpa because she's really worried that he's developing dementia. So it could be like a real range. And the GP will often treat according to kind of what they think is best. But if they ever think that actually this is a bit more concerning or this needs a bit more of a specialist look at, they will refer to a hospital specialist. So then the hospital side of medicine comes in with, so A&E is like your first point of call. So someone that's like broken their leg, they're not going to really go to a GP. They'll just be like, I think I need to go to A&E, or they'll call up an ambulance and 999 will be like, come into A&E. A&E is like this crazy triage room of patients with all different things, whether it's a surgical issue or a medical issue. And doctors will basically see them one by one, come up with a really quick diagnosis of what they think might be going on, do the initial examinations, do the very initial tests. And then, depending on whether it's a medical issue or a surgical issue, they will refer to the relevant people. So I then come in on the acute medical ward as the first doctor that will see a patient that an A&E doctor has said, I think this patient has the flu, they need oxygen, they need this amount of treatment, or I think this patient has a liver problem, they need to see a liver doctor. So you basically work up the ladder in the hospital of, depending on what care a patient needs, once they're seen by the first doctor kind of reviewing them, they'll be transferred onto the other that will then review to a specialist. And that's kind of how the pathway of medicine and surgery works as well. So as you go through medical school, you kind of get a flavor of what kind of specialties really drew you, like whether it was a GP working in the community or whether you liked the buzz of maybe like being in a hospital. But then within the hospital, what was it that you were really called to? Was it like neurology, which is what I'm interested in? Or was it like the heart? And are you the sort of person that enjoys actually medical work, or do you like being in the theatres and do you want to be a surgeon? So that was a bit of a ramble, but I think that's kind of where medicine and the different specialties kind of all interlink, if that answers your question.
Yeah, for sure.
Yeah.
So we think of our audience as like, some of them are in school right now wondering what they want to do. Do they want to study medicine? Do they want to work in a bank? What do they want to do? So a big aim of this podcast is to bring people on who can talk about their profession and like what it involves and also the pathway on how to get there. So like for the first part of the audience who are like, let's say, you're a student in school, you're wondering, how do I become a doctor? What is sort of the step-by-step, which subjects should I study at A-levels? And then there's the MCAT, the standardized test, if I'm not mistaken, and there's uni. Could you go through sort of like a pathway to becoming a doctor?
Yeah, okay. So I guess I'd say, like, looking back, it's quite intense when you think about it, because medicine is one of those careers that once you start, you're kind of on this train for ages. And it's only like up until now where I'm a junior doctor and I'm just coming to finish my 2 years as a junior doctor that I'm starting to path kind of what my career to look like. So when you make that decision in high school of being like, is medicine for me? It's quite a commitment, because there's a lot that is actually involved for the next kind of few years of your life. As a very starting point to know if you want to do medicine, I think you have to get some form of experience in a hospital or a GP practice. And I think you need to talk to people who do the profession. So, well, we can go into that in a separate question if you want, but I also grew up from a family of, my mum's a doctor. I have lots of aunts and uncles who are also doctors. But I think it has to come from yourself to be like, I really want to do this, because it is quite an intense pathway and an intense job. So speaking to people, of kind of whether they're junior doctors, whether they're a bit older, and kind of finding out, what do you do? Why did you do what you do? What do you love about the job? The same way that you do for any profession, I guess. The reason it's different with medicine is because, I guess, as opposed to other careers where you can do a different undergraduate degree that sometimes is kind of related, but not completely related, the job that you enter into, you kind of, from a slightly more mature standpoint of when you decide to enter that career, whereas medicine, you decide on it quite young. So the first thing I'd say is, find out from other people what they like about it, and then try and get experience. So for me, I did a week's work experience in a hospice, and I also did some work experience in a hospital. And even those, I think, just bearing in mind that they're literally just snippets into what medicine might look like. So if someone did work experience in a GP surgery, the experience that they might gain would be kind of sitting in, watching a doctor talk to lots of different patients coming in and out of the door for the whole day. And that's very interesting in itself. Like, you see a lot, but what you don't see is kind of the hospital side, where doctors are talking with lots of doctors, you're running around, you're trying to figure out different things. So if you based what medicine is like from one singular experience, it wouldn't really reflect what medicine's like as a whole. So getting as much experience as you can would really guide, I think, whether like within your gut, you're like, actually, I could see myself doing this, or like, no, I really don't like this. And after that, so I applied to medical school now like 8 or 9 years ago. I actually can't remember. So it's been a while. So I don't know how much has changed since then. But at least for me at the time, I needed to do, so I did for A-level biology, chemistry, maths. Doing some sciences and doing maths seemed quite a common route for medicine. Again, I don't know if that's changed now, but I do think that, I guess, biology helps from like, it makes sense in that you're learning about the body, you're also learning about other organisms in a way, but it does give a feel of, if you like science, it makes sense if you've done a science. And then maths is also just useful, I think, from like a logical perspective. Sometimes even in medicine, it does involve a bit of maths with calculations. So you're not doing algebra, but it's still useful to do. But something that I, looking back, actually think is very useful is a language. So I went to UCL where they really prioritized languages. But no one actually tells you, like, often in hospital, you meet patients that don't talk like English and they might talk in another language. So actually being a doctor that's like, I can speak Spanish or I can speak French, you're like gold dust. So if you're interested in a language, I would also say go ahead with doing one for A-level. I wouldn't think I think that would actually be a really good quality that you could also sell at an interview. And then in terms of entrance exams, so when I applied, there were different unis wanted different entrance exams. So there was something called the UK CAT and there was something called the BMAT. UK CAT was an entrance exam that was like accepted by a lot of med schools. BMAT was used by Oxford, Cambridge, UCL, and some of the other London unis. So again, I don't know if that had changed, but it's almost like a lot of tick box exercises. You need to show that you've got work experience. You need to show that you've passed these exams to a good degree. But then equally, if you get to interview, you need to show why you're interested. And I think that's when drawing in experiences will kind of sell you forward. And also just showing that they're not expecting you, if you're in school, to have done surgeries or have to done things like, but just showing that you've taken time to research why you think you might be good at this. Is kind of the stage I think that you get to for the point of interview of what's important.
It's kind of a two-pronged question. You're saying you really need to know before your A-levels that you want to become a doctor. You need to have that motivation there. What would you say to people who might find that later? Maybe they didn't have the support, the backing. Secondly, what about people who can't find the work experience, and how should you go about that maybe?
So in terms of, I'll answer the second question first. I think if you can't find work experience, because it is hard, like sometimes a lot of hospitals or practices they don't accept students, or they don't, even if you got it, you'd have a day researching or like a day having that experience. So what other things that people do, like there's lots of ways to get involved in healthcare professions. So like a lot of people I remember volunteered for St. John's Ambulance, which is also like a 2-in-1 where you gain practical experience, but you also get more route into kind of seeing like how paramedics work, what kind of conditions people might come in that need to go to hospital. So that's something that I remember a lot of people did when I was in medical school, or not in medical school, in high school. Equally, there's other ways to kind of be involved in the hospitals. So hospitals sometimes look for people who can come and volunteer to talk to patients. Maybe you can sometimes get roles within hospitals. So like phlebotomists are people who take blood. They sometimes are looking for more people. So phlebotomists.
I didn't know that.
Yeah, that's that's a term for someone who's like a clinical vampire. So they go around.
Surely they need to be trained for this.
You need to be trained, so you can get training to how to do it. So that's another.
But you don't have to be a doctor.
You don't have to be a doctor, no. So
or a nurse.
Or a nurse, no. So it's a role on its own. You'll have to do some training, but that's basically a part-time job. So the only issue would be that sometimes the times of being a phlebotomist wouldn't work while you're at school. So it might be a summer job. But equally, that's great experience to kind of also, while you're in the hospital, then you have a network to get, like, speak to a doctor and be like, I'm interested in this. Can I see something? Or volunteering. I volunteered at a disabled youth centre for a while during high school. That was like volunteering with children with like cerebral palsy and special needs. And that was, again, like I haven't had that experience since I've been in hospital medicine. That's almost quite a niche area, but it was still a way of me, one, getting used to kind of a caring role of medicine, because that is a lot what the job is involved in doing, but also, again, just meeting people who are patients to some doctors and kind of how that feels. And I really enjoyed that experience. And I think if you don't enjoy things like that, I would also say that maybe medicine isn't for you, because a lot of it is sometimes involving like working for people out of your own kind of compassion. So if that really is off-putting, then maybe not medicine. And then, sorry, to answer your first question, if you realize later in life, like you'd done another degree, and you're like, actually, I think medicine is what I want to do, I think it would be the same advice, that you need to gain that experience to know, do you really want to do it? Because I guess at that point, it's a bit harder because there's maybe more financial pressures of having to fund the degree. Graduate entry medicine is a bit more competitive because there are less places compared to undergrad. But then equally, I do think if it's something that you're really passionate about doing, you should do it. And often the graduate medics that I've met are the most keen doctors, because I think they've analysed the situation so much that they're like, I know that the costs or the sacrifices of doing this, but I still really want to do it.
So do you have any advice for students that want to apply for medicine in uni?
Mm-hmm.
How to get through the grueling interviews and how to get through all of it?
Yes. So I think it's also actually a shame that it is this competitive, because we do need doctors. And I think I do remember when I was applying for medical school, like my sixth form life felt like I was jumping through like a million hoops. And I think that is the standard experience for a lot of people applying to medicine. Like you've got to get good grades, you've got to then pass these entrance exams. Then when you finally get through, you have this interview. My main advice is firstly, different medical schools interview in slightly different ways. So some interviews are like this, where you sit in front of a panel of doctors, or sometimes, all doctors of maybe different age ranges as well, or stages of their degree or career. And they will ask you a set of semi-predictable, sometimes a bit unpredictable questions. So the basics would be kind of why medicine, or, can you tell us about something that you mentioned in your personal statement? So whether that was work experience that you did, or it was a volunteering experience that you did. They might ask some questions to kind of get a bit more about your own personality out, to see whether that matches the attributes of a doctor. So, I was saying I got a question at one of my interviews of, can you tell us about a time that you failed and how you came out about that? And I think, interestingly at the time, out of all of the hoops that I jumped, the one thing that I was unhappy about, I didn't really like how well I got my score for one of my entrance exams. And so on some of the entrance exams, some of it involves like either questions, or one of them was like a paper, where you had to answer like an essay question. And I still remember that immediately after the essay was done, I went home and I was so annoyed, because I was like, that is just not what I wanted to write. And I actually wrote back at home. I didn't think it would count for anything, but I wanted to, because I'd done so many essays, I wrote what I think I should have written. And it just so happened that at the interview, they asked me this, and they were like, oh, just on this question of, failure. So I said, like, I really regretted the question that I wrote. And I basically dissected exactly what I wanted to say, and ended up getting into a discussion about that. So in a way, it really benefited me that I actually went through the process of reflecting on something that went wrong. And I think that really helped me in my interview, ironically, because you don't think that you're going to be asked about failure. And the other thing that I'd say is that you need to demonstrate like a personal impact or approach of why you're interested in medicine that makes you unique to other people. So for me, like you mentioned at the start, I got into medicine, or I was drawn to medicine, because of a close family member that had Parkinson's. He was diagnosed like maybe a couple of years before A level started. So around the time where you start thinking about careers. And yeah, watching his quite sudden deterioration in his health really impacted me. And I'd not thought about medicine as a career up until that point. And I just found myself naturally quite drawn to knowing what was being done clinically for him, but also what research was being done. So I just proactively got quite involved, and all of those things worked very well to also talk about. So I'd say for anyone applying, if there's something that you find quite interesting, even if it's very small, really hone into that and like see how far you can take that. Because I think to an interviewer, they will be drawn to a candidate who's shown that I have this interest and I've not just kept it there. Like I've actually tried to see how far I can take it. And they like curious people. I think medicine has to attract someone who's quite curious to learn. And then finally, I'd say some interviews are like almost like a medical version of speed dating. So you go into this room and there'll be lots of different mini stations where they will ask you, like one of my stations was, about an ethical, like a dilemma of whether you should give a liver transplant to a patient who's a drug abuser or to like someone who's been waiting in the healthcare system for a really long time, like who deserves it more, like questions like that actually even now are very hard to answer, but they again want you to see that you've read the GMC guidelines of kind of what makes a good like doctor. So being aware of kind of guidelines that doctors use, being aware of current topical events as well. They might bring out like a story that's recently in the news and say, have you read about this? Mm-hmm. So try to cover it as many angles as you can. So a bit about you, a bit about what's going on in medicine is what I'd say to smash an interview.
What's medical school like?
I thought medical school was really fun. I think actually once you like jump it through that hoop of getting in, it's then like a whole other world. So medical school for me was 6 years. I did an intercalated degree within the medical degree, which some unis offer. So in my 3rd year, I did like a year in neuroscience, and basically kind of just hopped in with all of the other actual neuroscience students. It was a bit of a fraud. But medical school, I thought, was such a big part of my life, and I've made some of the best friends that I have through there. Also shaped a lot of experiences that I have now. Different med schools teach medicine in different ways. I went to UCL, and the way that they taught it was that the first few years, the first 3 years at least, it's known as preclinical years. So you're basically learning a lot of the theory of medicine. So you're like basically book learning for 3 years with the odd kind of GP placement in, but nothing really substantial clinically. And then from 4th to final year, so 6th year, you're then actually rotated to be in the hospital wards, where you're actually on different attachments called firms, where you rotate with a small group of people in medical school around the different specialties of medicine, from like cardiology, like gastroenterology, surgery. And those are the years when you start to get a flavor of what hospital working is like, but also maybe even glimpses of what you might be interested in doing once you actually become a doctor. And so each year, it is quite long years. Often I found, like at UCL, we had exams all at the end of the year. So there is this culture that's known that medics tend to go out a lot or have a lot of fun, but it's probably because all our exams are at the end of the year. So you end up cramming a lot for the last term. But there is a lot to take in.
The rest is a breeze then.
Rest is, yeah. So it's just the exam period and then have fun. But no.
And beyond that, like when you actually get into the nitty gritty and you get placements, I don't know if that's the right word, you start working in hospitals.
Yeah.
Those constitute at first your foundation years.
Yeah.
Is that right? Right. F1 and F2.
Yeah.
So firstly, if you could explain a little bit about what that means. And secondly, do you get a say over where you go? I have friends like kind of touring the country.
Yeah.
Do you get to decide which hospitals you're placed at?
So you do, to some extent. So in terms of once you become a doctor, the general pathway in the UK is that, so as you said, you have 2 years of foundation year training. So you're like the baby doctors of the hospital, where you get a total of, within those 2 years, a total of 6 clinical rotations, where for 4-month blocks, you are working in a specific specialty job and being the role of a junior doctor.
Do you get to choose the specialties too?
So it really varies. So I'm on a specific rotation where, because I'm really interested in research, I applied for a slightly separate type of being a junior doctor where one of my 6 clinical rotations is switched with a research job. That is slightly more competitive, and you have to interview like you do in medical school to get that post because they don't have as many in the country. But if I didn't do that, the way that it works is that, so how you rank in medical school, so how you perform in your exams, you are ranked in deciles. So at the end of medical school, you basically come with like a portfolio score that is a combination of, one, how well you ranked in your medical cohort, which is often also quite tough because I guess how you rank depends on what your medical school was like, who your other kind of medical colleagues were. So where you place might actually have been different depending on what medical school you went to. But either way, doing as well as you can helps with your final grade, so when you're assessed. So 50%, from what I understand, of your grade comes from your medical school performance in your examinations. And then the other 50% is this really random exam that you do called the situational SJT, situational judgment test, that you do in like a driving test theory center with people doing their driving test. And it asks you a series of basically like medical ethical questions. So things that should seem logical, but you also have to rank the best appropriate response. So it's not necessarily a hard exam, but it's a stressful exam because it counts for almost 50% that also your medical school grades had accounted to. And based on what your overall score is, all medical school students in the country are then ranked. So you will then apply for where in the country you would like to have a job in. So you apply for deanery. So London counts as one deanery. Like Wales might be a different deanery. Scotland might be a different deanery. And you rank where in the country you would like to be, ideally. Depending on how well you perform, you will then either get your first choice deanery or you won't. You might get your second or your third choice. Once you've got your deanery, you then have a process of ranking all of the hospital jobs that are available and seeing what rotations you might best like. So say if you were really interested in cardiology, you might choose the hospital that has the cardiology rotation at the expense of where the hospital is. But actually, I'm thinking back, you're actually advised to do the opposite. I think when you think about where you want to be as a junior doctor, I think location is actually the most important thing, because job placements, you can always kind of still get a job in the future that you might not get a placement in. But I think where you live, in my opinion, is more important. So like prioritizing like a hospital that you really want to be in, I think is better than choosing over jobs. But that's my opinion.
Really?
And yeah, so that's what kind of how you get the jobs that you get where you be in the country. So I have some friends that didn't get their first choice and went somewhere else in the country, but they're also having a really good time there. It's kind of a really novel 2 years of your life where, again, you're like experiencing your first kind of career job, but also with different people in a different hospital. So it's daunting but fun in a different way as well.
Especially for me, this has been so insightful. Like I've learned so much in the past hour or however long we've been recording this. To kind of wrap it up, what would you say to someone who isn't sure if they want to become a doctor, maybe a young person, or equally a young person who does want to become a doctor, to focus on the fun stuff? Are there any programs they should be watching? Like you mentioned Grey's Anatomy. Are there any books they should be reading? How should you prepare in a more fun way?
Any podcast they should be listening to?
Oh yeah, listen to this podcast. I think, to kind of echo what I said before, I think if you're interested in medicine, that's amazing, because I do think, I'm biased, but I think it's one of the best careers. But I think finding out also what sort of person you are, so like whether you are interested in, one, if you're really interested in working with people, if you're compassionate and want to help people when they're sick, and if you like the science behind it, finding ways to kind of grow any of those passions is really important. I read a book, so I didn't actually watch any of the medical shows when I was doing medicine. It was only in my final year I started watching Grey's Anatomy, and I would kind of convince myself it was revision, but it wasn't. But it is actually quite, I mean, apart from the drama, like some of the cases that come in, as ridiculous as they sound, I'm sometimes like, that could so easily happen in the hospital. Like, I'm not surprised. So yeah, and what else would I say? Yeah, find a passion even within yourself, because even if you kind of go in, you do all that research, and then actually at the end of it you think, oh, maybe medicine isn't for me, I think it's still really useful to find what really interests you. And medicine is like a lifelong career that once you're in the system, you don't really want to leave from it. I mean, you can, but knowing that you want to do it and knowing as much about yourself to see if you're suited to it will only help you. So, and I would say don't be too daunted by all of the hoops that you have to jump, because it does feel overwhelming. But actually, I feel like the hardest bit was getting into medical school. Once you're in medical school, I personally don't think what I was learning was that hard conceptually. It's just a lot to learn. So I think there's also this perception that medicine is super hard and you have to be super, super intelligent to get in. There's an element that you do have to be intelligent, but you also just need to be focused, and you need to actually know how to manage your time, how to prioritize, like how to get to where you need to be. So I'd say good luck to anyone who's considering.
Amazing.
Great. Thank you so much, Theresita, for coming on. Is there anything you want to plug? Is there anything at the end? Are you happy for students to contact you on LinkedIn maybe, or any other?
Yeah, I need to get a LinkedIn actually.
Okay. Okay, once that's up.
Yeah. No, I don't actually have a plug, but I hope what I said was useful. So yeah.
Incredibly. Thanks so much for coming on. Thank you.
Thanks so much.
Thanks for having me.